welcome to my YouTube channel, Everything ML. My name is Mohau. I'm a student at the University of Zambia, UNZA. I created this channel mainly to introduce second year courses offered under MBCHB, popularly known as medicine. But as time goes by, the content I'll be giving you guys will be way more than this, and it's going to be touching other interesting areas that my subscribers would be interested in. So make sure you hit the like button and subscribe so you don't miss out on any of this amazing content. The next videos will probably be of interest to anyone who is going into their second year of the medical program at UNZA, also those who just started their journey in MBCHB and would like to know what is there in second year content, or maybe you just want to study ahead with guidance. So I'm just going to give you guys a list of weather courses which are found in second year. Or things may change in the future, but as of 2022, these were the courses that were available. So we have anatomy, physiology, organic chemistry, biochemistry, immunology and microbiology, psychology, and community-based education. Today, the introduction is anatomy. This is the only course having 3 branches that are taught separately, and the 3 branches of anatomy are embryology, growth, and histology. We'll start with embryology. It's a branch of anatomy that deals with studying the formation and development of an embryo into a fetus, starting from the pre-fertilization events to when you have a fully developed fetus. But something really interesting that you also get to learn are those things that can go wrong during this period, which we call teratology. So under teratology, that's where you look at how congenital abnormalities come up. This picture right here is of a baby with Down syndrome, and in teratology, you get to learn the features that such babies have. For example, having a flat face, a tongue that tends to stick out, malformed ears, moderate mental retardation, and this Down syndrome is caused by an extra chromosome. Then you've got a very important part that is always examined, which are the clinical considerations, where you apply what you've learned to real life situations. You have to keep in mind that whatever you learn starting from second year going up actually occurs in real life. It's what you're going to be seeing and experiencing once you're in a hospital setup as a doctor. You need to know how it all began before you can start treating such conditions. So next up is gross anatomy, which deals with the study of structures that are visible to the naked eye. I think of the 3 branches of anatomy, gross is the bulkiest. It actually covers embryology as well. You need to know the embryonic origins of certain parts of the body, like the lungs, spleen, vena cava, right and left atria, right and left ventricle, plus so much more. And this one really gave me a hard time, I have to be honest. So under gross anatomy, you get to learn structures visible to the naked eye by using actual human bodies in a dissection room. It might sound scary to some people, but you get used to the room the more time you spend in it. I actually find it to be one of the most interesting parts offered by the course. So let's now discuss a little bit more about how we can study gross anatomy. Gross anatomy can either be studied using the method of systems or by the method of regions. So in systemic gross anatomy, you learn by systems like the digestive system or in the circulatory system, while in regional anatomy, you learn by specific regions like the upper limbs, the lower limbs, and the abdomen on your cadaver. Usually, when it comes to gross, you are taught to dissect to get to the area of interest, but for us, we didn't get to do the dissections by ourselves. Instead, we had demonstrators do that for us because we had run out of time. That being said, gross anatomy is a very practical branch of anatomy. You actually need to study before you get to the dissection room so that it's easier for you to follow through what your demonstrator will be teaching you, because you learn a lot of things, guys, like a whole lot of things within a short period of time of about 40 minutes. I think I only didn't study for the DR sessions a few couple of times because I didn't have the time, but I always made sure to know a few things at least before the sessions with the demonstrators. And guys, the times when I didn't study, I came out of the DR feeling as empty as I came in, probably because of the amount of new information that was coming at me in such a short period of time. So how it used to be was we would have 2 days in a week on the lecture schedule for DR sessions. Then aside from that, the DR was for most of the time open to students to revise even after midnight. So my friends and I would find time to revise what we learned for about 4 hours, would give ourselves parts to present to cut down on time. And guys, group presentations really helping retention. I think I'll give you guys a general idea of what anatomy exams are like towards the end. Our DR sessions would start from about 10 a.m. on average, and the last group would be expected to be out by 5 p.m. on average. My class had more than 1,000 med 2 students, so we would be put in groups for these sessions because the DR is limited in terms of space in cadavers, which are the bodies we worked with. So the main things you need in a DR, just in case you're wondering, I would say are surgical gloves, surgical face masks, a lab coat, and closed shoes, preferably boots. You need gloves because I personally didn't like the idea of touching body parts with my bare hands, but I started outgrowing that. Now I usually wear the gloves because I don't like how my hands get wrinkled and dry whenever I touch anything with formalin on it. So the face masks, because the formalin, which is the preservative used to keep the bodies as fresh as possible, has a pungent smell, and the smell at the DR isn't really pleasant, speaking on my behalf. By the way, it's normal to have a runny nose due to the same pungent smell of the formalin when you're in the dissection room. It's best to get yourself a box of gloves if you can't afford. Maybe even share the costs with a friend. I didn't even actually get to use all of my gloves, maybe because we only spent half the time we're supposed to in the DR due to the delayment. So maybe if we had started the sessions earlier, I would have used more than 60% of the gloves. But I can still use the gloves either way, the ones which are remaining in year 3, because we'll be doing head and neck then. I got my box of surgical gloves and a box of surgical face masks from Musaka Chemist for those who can manage to get them, and I got it at a reasonable price, I can say. Lab coats are mandatory for all DR sessions, as in the ones specified on the schedule. So a lab coat just keeps your clothes safe from chemicals, and you'll be working with dead bodies, guys. It just makes sense to have a lab coat on, and at least your clothes won't absorb too much of that DR scent. Boots, because I feel like the DR is just a different type of environment. You never know sometimes what you're stepping on the floor and taking back home. Up next is histology, which is basically the study of tissues and their structures with the aid of a microscope. My class wasn't opportune to use microscopes for histology. Instead, we had pictures of different tissues displayed for us on LCD screens in the lecture theaters. These are the LCD screens at UNZA, and this is at TLC1. We would have someone teach us about tissue preparations and the different stains and other chemicals used during the process. We would also learn which tissues are found in different parts of the body and why that is. With histology, you need to be good at identification. For example, here is an image. You can try to guess in case you get it right. So this is an image of compact bone. Let me show you another image. So this is an image of elastic cartilage, which is found in places such as the epiglottis. So as you can see, some images look complicated whilst others are very easy to identify. I mostly just mastered these things, and to me, histology seemed to be the easiest, though I should warn you, you'd have to be very careful when preparing for histology exams because the images can be confusing if you aren't well acquainted with them. Same goes for DR exams and just other assessments. So the next slide was supposed to be on assessments, but I have purposefully deleted it. So if you guys want to know about how secondary med assessments for anatomy are, then hit the like button and subscribe to this channel. The more likes and subscriptions, the more sooner I will post a video on assessments. Thank you guys for staying tuned up to this point. Please don't forget to like and subscribe to my YouTube channel so you don't miss out on my latest videos. Turn on your notification bell. I'll see you